Welcome back, everybody, for another deep dive.
Yeah.
Last time we got pretty deep into eyelid anatomy.
We did.
And all the complexities of this, seemingly simple structure. And today, we're going to keep going down that road.
Yeah.
But this time focusing on common eyelid lesions.
Right.
And I think a good place to start is with one of the most common, the chalazion.
Oh, a chalazion, yeah. Also called the meibomian cyst. But essentially, it's a chronic inflammatory lesion of the meibomian glands, or the Zeiss glands. And it's caused by retained sebaceous secretions.
So right away, can you remind us about the meibomian glands we talked about the last time?
Yeah.
They're in the tarsal plate, right?
Yeah. So they're these really interesting glands that are kind of vertically oriented within the tarsal plate, and they produce this oily substance that's really important for our tear film. And what happens is the opening of those glands can get blocked for a number of reasons.
Okay.
And then that leads to this buildup of secretions behind the blockage.
Got it. So then those secretions kind of back up and cause this little bump.
Exactly. And under the microscope, it looks really interesting. We call it a lipogranuloma.
A lipogranuloma.
Yeah, and it's basically this collection of fat.
Okay.
And then these specialized inflammatory cells we call epithelioid cells, and these multi-nucleated giant cells.
Wow.
And then lymphocytes.
So basically your eyelid is throwing a microscopic party.
A party?
But not the fun kind.
Yeah, not the fun kind. Exactly. So, and another really important thing to remember is that chalazia are often associated with other inflammatory conditions like blepharitis and rosacea.
Blepharitis, we definitely talked about that last time. Rosacea, that's that skin condition, right?
Exactly.
Yeah.
It affects the face. It can cause redness and these little bumps and pustules.
Okay.
And it turns out that there's a strong link between rosacea and chalazia.
Oh, wow. And speaking of links, this is what I find really fascinating.
Yeah.
I read that a cancer drug can actually cause chalazia.
Yeah, bortezomib.
Bortezomib.
Yeah, and I know that sounds strange, like why would a cancer drug cause this eyelid issue? But it turns out that bortezomib can interfere with the normal function of the meibomian glands, leading to those blockages and the development of chalazia.
Huh. That's wild. I would never guess that.
Yeah, it's one of those things that just highlights how interconnected different parts of our body are.
It really does. And before we move on from chalazia, there's one more thing I wanted to touch on.
Sure.
The importance of biopsy, particularly when you have a recurrent chalazion.
Yeah, that's a great point, especially in older patients.
Right.
Because while most chalazia are benign, there's always a small chance that it could be something more serious masquerading as a chalazion.
So it's better to be safe than sorry.
Exactly.
Okay, so now that we've got a good understanding of what a chalazion is and how it forms, let's talk about how it actually presents.
Okay.
Because I imagine there are some telltale signs.
There are.
That can help distinguish a chalazion from other eyelid bumps.
Yeah, so one of the key features is that a chalazion typically presents as a painless nodule within the tarsal plate. And this develops gradually over time. It's not like you wake up one morning and suddenly there's this huge painful bump. It's more of a slow and steady process.
Got it. So it's a gradual onset of a painless nodule that's classic for a chronic chalazion.
Right, but if that chalazion gets infected, which can happen, then the picture changes quite dramatically.
So then it becomes more of an acute situation.
Yeah, exactly. It can become really painful, red and swollen.
But that's what we call an internal hordeolum, right?
Yeah, or an acute chalazion.
Essentially an internal style.
Yes, exactly.
So pain is a key differentiator.
Exactly.
Chronic chalazion, typically painless.
Right.
Acute chalazion or internal hordeolum, quite painful.
Exactly. And when we examine the eyelid, we look for certain clinical signs.
Like what?
Well, the nodule itself is usually pretty easy to feel. It's firm, and it's located within the tarsal plate. We might also see some secretions expressed from the meibomian gland. And sometimes there's even a little granuloma on the conjunctiva, the inside of the eyelid.
Interesting. And what about if the Zeiss glands are involved?
Good question. If the Zeiss glands are involved, we'll see lesions at the lid margin right where the eyelashes come out.
Got it. So it really depends on which gland is affected.
Exactly.
Okay. So we've talked about what a chalazion is, how it forms, how it presents clinically.
Yeah.
Now, the big question, what can you actually do about it?
Right. So the good news is that many chalazia will actually resolve on their own.
Really?
Yeah, with just a little bit of conservative management.
So watchful waiting.
Exactly. Watchful waiting and warm compresses.
Ah, warm compresses. That seems to be the go-to for a lot of eyelid issues.
Yeah, it really is. Warm compresses can help soften those secretions and promote drainage.
So it's like giving those clogged glands a little nudge.
Exactly. And for fresh lesions that are near the lid margin, manual expression can also be helpful.
Manual expression, so like squeezing it out?
Kinda, but it's a very specific technique that needs to be done carefully by a doctor.
Right. Of course, you don't want to be doing any at-home surgery on your eyelids. Now, what about those more stubborn chalazia, the ones that don't respond to warm compresses or manual expression?
Right. So for those, we have a couple of other options.
Okay.
One is steroid injections.
Steroid injections right into the eyelid.
Yeah, it sounds a little scary, but it's actually a very common and effective treatment.
How does it work?
So the steroids help to reduce inflammation, and that can shrink the chalazion and allow it to drain.
Okay.
Studies have shown that steroid injections can resolve up to 80% of chalazia.
Wow, that's pretty impressive.
It is, but there are some potential risks.
Such as?
Well, one is skin depigmentation.
So the skin could lighten?
Yeah, and another is fat atrophy.
Fat atrophy, so like the irid could become thinner?
Exactly, and then there's also a very rare but serious risk of retinal vascular occlusion.
Oh, wow, that sounds serious.
It is, but it's important to remember that it's extremely rare.
Okay, so steroid injections, effective, but not without risks.
Right. And then the other option for stubborn chalazia is surgery.
Surgery. Okay, so what does that involve?
It's actually a fairly straightforward procedure. We basically avert the eyelid, make a small incision, and then curettage the lesion.
Curettage?
Yeah.
It means scraping it out.
So you're basically removing the contents of the chalazion.
Exactly. And the good thing is that we don't use sutures for this procedure.
No sutures.
Nope. The incision is so small that it heals on its own.
That's good to know. I always imagine eyelid surgery being quite involved.
Yeah, it can be for some conditions, but for a simple chalazion excision, it's really not that bad.
Okay, so we've got conservative management warm, compresses manual expression, steroid injections, and surgery.
Yeah, those are the mainstays of chalazion treatment.
And anything else we should keep in mind?
Well, one really important thing is to address any underlying blepharitis.
Right, because as you mentioned earlier, they often go hand in hand.
Exactly. And for recurrent cases, especially in patients with acne rosacea, systemic tetracyclines can be really helpful.
Systemic tetracyclines, so antibiotics taken by mouth.
Yeah, they can help to reduce inflammation.
And improve the function of the meibomian glands.
Got it. So it's not just about treating the chalazion itself, but also addressing any underlying conditions.
Exactly. A holistic approach is key.
Okay, so we've covered the chalazion in quite a bit of detail. As we all know, there's a whole world of other eyelid cysts out there.
Oh, yeah.
Each with its own unique personality.
Exactly.
So let's move on and meet some of these other eyelid cyst celebrities.
Sounds good.
Let's start with one that's closely related to the chalazion, the cyst of Zeiss.
Okay, so the cyst of Zeiss is also caused by blocked sebaceous glands.
But not the meibomian glands.
Right, not the meibomian glands.
Which glands are we talking about here?
The Zeiss glands.
The Zeiss glands, remind me about those.
Yeah, so the Zeiss glands are much smaller than the meibomian glands, and they're associated with the eyelashes.
Okay.
So each eyelash follicle has its own little Zeiss gland that produces oil to lubricate the eyelash.
Got it. So a cyst of Zeiss is basically a blocked Zeiss gland.
Exactly. And clinically, it presents as a small, firm, non-translucent nodule on the lid margin.
Right at the base of the eyelash.
Yeah, exactly. So it's kind of like a miniature version of a chalazion, but right next to the eyelash.
Interesting. Okay, so that's the cyst of Zeiss. Now, what about the cyst of Moll?
The cyst of Moll.
Yeah, that one sounds a bit more exotic.
Yeah, it's a bit different. It's also known as an apocrine hydrosystema.
Apocrine hydrosystema.
Yeah, and it involves a different type of gland, the apocrine sweat glands.
Wait, sweat glands in the eyelids.
Yeah, believe it or not, we have sweat glands in our eyelids.
Never thought about that.
Yeah, they're not as numerous as the sebaceous glands, but they're there.
Yeah.
And they can also get blocked, leading to sedative formation.
So the cyst of Moll is basically a blocked apocrine sweat gland.
Exactly. And it typically presents as a round, non-tender, translucent nodule on the anterior lid margin.
Anterior lid margin. So that's like the front edge of the eyelid.
Yeah, and it often has a bluish tint.
A bluish tint. Oh, that's interesting.
Yeah, it's because the fluid inside the cyst is clear.
Okay, so it's like a little water balloon on the eyelid?
Kind of, but it's usually much smaller than a water balloon.
Right, of course.
But yeah, that's a good way to visualize it.
Okay, so we've got the cyst of Zeiss, the blocked Zeiss gland.
Yeah.
And the cyst of Moll, the blocked apocrine sweat gland.
Right.
What other eyelid cyst characters are out there waiting to make their debut?
Well, there's a whole cast of characters, but maybe we should take a quick break.
Okay, yeah, let's take a break and we'll be right back with more eyelid adventures. Okay, we're back and ready for more eyelid excitement.
More eyelid excitement.
Exactly. So we've talked about the Chalazia, the cyst of Zeiss, the cyst of Moll.
Yeah.
What other eyelid cyst celebrities are out there?
Well, let's talk about those tiny little white bumps that you sometimes see often in clusters on the eyelid.
Oh, yeah. I know exactly what you're talking about, those little pearly white things.
Exactly. Those are milia.
Milia.
Yeah, and they're incredibly common, and they're basically these little cysts that are filled with keratin.
Keratin, isn't that the stuff that makes up our hair and nails?
Exactly. It's a protein that's found in our skin, hair, and nails.
Okay, so how does it end up forming these little bumps on the eyelids?
Well, sometimes that keratin can get trapped beneath the surface of the skin, and then it forms these tiny little cysts.
So it's like a little pocket of keratin that's decided to take up residence in the eyelid.
Exactly. And they're usually completely harmless. They often go away on their own.
Okay, good to know.
But if they're bothersome, the dermatologist can easily remove them.
Got it. So it's not really something to worry about unless it's causing you cosmetic concern.
Right.
Okay, so we've got blocked oil glands, blocked sweat glands, and now little keratin pearls.
Yeah. It's quite a collection.
It is. Is there anything else that can cause these eyelid bumps?
Well, sometimes it's not about blockages, but rather about the skin itself growing in an unusual way.
Okay, I'm listening.
Have you ever heard of epidermal inclusion cysts?
Epidermal inclusion cysts. I think I've heard of that, but I'm not entirely sure what it is.
So think of it this way. Our skin is made up of different layers, right?
Right. Yeah.
And sometimes a little piece of the outer layer, the epidermis, gets trapped beneath the surface.
Like a little island of skin that's gone astray.
Exactly. And that little island of skin starts to grow and form a cyst.
So it's not a blocked gland. It's just skin growing where it's not supposed to be.
That's right. And just like milia, these cysts are usually harmless and often disappear on their own.
Okay.
But if they cause discomfort or become infected, they can be removed.
Got it. So another one to add to the list of eyelid bumps.
Exactly. Now let's talk about a condition that's a bit different.
Okay.
Xanthelasma.
Xanthelasma. Now that one sounds familiar. Isn't that something to do with cholesterol?
You're right on the mark. Xanthelasma are yellowish plaques that form underneath the skin, often near the inner corners of the eyes.
I've definitely seen those before. They kind of look like little yellow patches.
Exactly. And while they're not harmful in themselves, they can be a sign of high cholesterol.
Really? So those little yellow patches on the eyelids could be a clue to something going on inside the body.
That's right. It's not a foolproof sign, but it's definitely something to pay attention to. If you notice xanthelasma, it's a good idea to have your cholesterol levels checked.
Makes sense. It's like our eyelids are sending us little health memos.
Exactly.
Yeah.
Now, what about treatment for xanthelasma? Is it purely cosmetic, or is there a medical reason to address it?
Yeah, that's a good question.
Well, treatment is often driven by cosmetic concerns, as the yellowish plaques can be quite noticeable, but addressing any underlying high cholesterol is also important.
So it's a two-pronged approach, treating the cosmetic aspect and addressing the potential underlying health issue.
Exactly.
This has been an incredible journey into the world of eyelid bumps. It's amazing how much we take our eyelids for granted until they start acting up.
I agree. They're such small structures, but they play a vital role in protecting our eyes and keeping them healthy.
Well, I think we've covered pretty much everything we set out to cover today.
Yeah, I think so.
We talked about the Chalazia, the cyst of Zeiss, the cyst of Moll, milia, epidermal inclusion, and I have to say, I learned a lot.
Me too. It's always fascinating to delve into the intricacies of the human body.
Absolutely. And to our listeners, thanks for joining us on this deep dive into the world of eyelid anomalies. Stay curious and keep those eyelids healthy.